So I always ask every single audience that I give a keynote on, can you please stand up and remain standing if you have or had metals in your mouth, like you do. Metals in your mouth, stand up. If it can be amalgam filling, can be titanium implant, or gold crown, doesn't even matter, stand up. And the next question is, you have or had a root canal treated tooth, which is essentially a dead body part. Stand up. And the last and final question is always, did they remove your wisdom teeth? At the end, 90% at least stand up, because everyone has some sort of an oral health interference. And this is the point I want to make in this realm of biohacking, health optimization. We're talking about gut health, about brain health, about all the different modalities you can do and you should do. But the thing is, if this is all on point and you're still not feeling superhuman and you just answered one of these questions with a yes, then it's time that you look into a biological dentist who understands that the mouth is the entrance to your body and it's showing you the overall picture. And if you have metals, root canals, or would remove wisdom teeth, there's an underlying chronic inflammation that might cause 24/7 stress in your body.